Diabetes seems to be most difficult to manage, but it is a disease that must be managed well. There are so many drugs for treating diabetes, and certain medications used can most potentially lead to nutrient depletion. If you take diabetes medicine for a long time, you may lack this nutrition. Coenzyme Q10 is effective in recovering from fatigue, maintaining cardiovascular health, preventing age, gum hairs, strengthening the immune system, weight loss, and improving symptoms in patients with depression. It is a very crucial element for improving insulin sensitivity in diabetics. But this helpful nutrient coenzyme Q10 is very easy to diminish when taking certain medications like metformin or sulfonylurea. Metformins reduce glucose production in the liver. Those are widely used medications to get clear results in glucose metabolism. Mechanisms are not fully understood, but it reduces glucose production in the liver through AMPK pathways. Physiologically, metformin acts directly or indirectly on the liver to lower glucose production. It causes deficiency by inhibiting NADH oxidase enzymes involved in synthesis. Sulfonylureas, another type of diabetic drugs, are also may decrease coenzyme Q10 levels. In the case of the sulfonylurea, which promotes insulin secretion, it inhibits enzymes in energy metabolism. Taking sulfonylureas, except glimepiride, may deplete coenzyme Q10. The heart needs plenty of coenzyme Q10 for its regular functions, such as supplying blood to the whole body. Lack of coenzyme Q10 can lead to poor heart function. It can develop into cardiovascular disease. Without coenzyme Q10, serious problems such as angina, high blood pressure, and congestive heart failure can occur. We should find food or supplement while taking metformin. Foods to supplement this are abundant in meat such as beef, eggs, cod, mackerel, salmon, sardines, spinach, broccoli, whole grains, vegetable oil, and the liver. Although the amount of coenzyme Q10 required by our body is 30 to 6 mg, it is insufficient to intake the proper amount only with the naturally produced coenzyme Q10, so it should be taken in the form of nutritional supplement. Long-term use of metformin has been associated with lower levels of vitamin B12. Metformin may bother B12 to be absorbed well. Serum vitamin B12 deficiency occurs in 22% of patients with a megadose of metformin. Use of similar to metformin, diazolidinediones have been associated with lower vitamin B12 too. This deficiency can lead to megaloblastic anemia, neuropathy, and other neurological complications. There is a symptom similar to numbness in the feet of diabetes. So it is better to eat it well on a daily basis. Whoever takes this kind of medication should be monitored for the risk factor for supplying vitamin B12. Food includes meat, poultry, seafood, and eggs and milk. It is also good to take Group B nutritional supplement containing B12. Some drugs lower sugar absorption to prevent high blood sugar after meals. Alpha glucosidase inhibitors lower blood glucose by delaying the digestion and absorption of the complex carbohydrate. However, iron absorption could be reduced by these alpha glucosidase inhibitors like acarbose and miglitors. Iron deficiency anemia should be monitored when taking these kind of inhibitors. Lack of folic acid caused by metformin can lead to anemia and joint pain. Magnesium plays a huge role in diabetic patients. Magnesium boosts the insulin reaction itself and improves sugar transport. Chromium is also a mineral necessary for carbohydrate and fat metabolism. Suppose you eat a lot of refined carbohydrate. In that case, chromium is often insufficient. So it is good to check the chromium contents of regular vitamins. Zinc also helps to produce and secrete insulin. Selenium is also helpful to preventing oxidation of the pancreas, and complications of diabetes. Alpha-lipoic acid is a powerful antioxidant and is also used to treat diabetic neuropathy. It stabilizes blood sugar levels by improving sugar transport. Vitamin B 1, 2, 3, and 5 groups for carbohydrate metabolism. Omega-3 lower inflammation level in diabetics, and it is recommended to take it, especially in people with diabetes with high triglyceride. Chlorogenic acid may have a blood sugar control effect as an active ingredient of the banana leaf extract. It is important to note that individual responses to medication can vary. And not everyone will experience these nutrient depletions. If you are taking medications for diabetes, regular monitoring of nutrition level through blood tests can also help identify and address any kind of deficiencies.